Hi, so welcome to the TKC Smile Design series. I'm going to run through another All-on-X case. So we're going to run through this case. This was done some years ago, but I think it's a really good case to showcase just because it highlights a few things that I'd like to discuss. So this is a case that we took on quite a few years ago actually. Poor patient had advanced gum disease. Again, this is hereditary in many ways, and gum treatments just were not working because it's a very aggressive gum disease. And if you look here, this is how the mouth looked initially. So massive amount of bone loss, and also just the gums look really red, inflamed. You can see it's very active. So what we decided on was to say, look, there's no real hope for these teeth. Radiographically, the teeth were completely shot to pieces. There's no bone structure which was holding them. And what we'd like to do is remove the teeth before the bone has disappeared. So we arranged to have all the teeth removed under sedation, and we sedate all our patients when we do such a procedure, and then we place 6 implants in the top and 4 in the bottom. We cleaned out all the infection and everything, and it was all done on the same day. So that's what we were able to do for this patient. And then made a provisional prosthesis, which I'll show you, which was fitted same day. And then the final one was done 3 months later once the gum had healed, basically, and everything had shrunk. So this is the before, and this is the after. So the left side is a provisional prosthesis that was placed, which was done immediately, in effect. All of this is milled, so we have a milling unit that makes these prostheses. So they fit well, they look good, they're one colour, these milled PMMA acrylic blocks, but they look good and they fit well, and they allow time for everything to heal. So you can see here, this is the provisional prostheses here and here. The bite is fantastic. It looks good. It's got some pink on the gums just to make it even look a bit more natural. And then you can see the final ones are here. Now, this is not ceramic. This is a composite-based material. The patient did not want to have ceramics in this case. Now, if we were doing the case, we would do ceramics because they just look even more natural. They're more expensive, but they just look better. So these look nice, but they're one colour rather than having multicolored teeth with lots of translucency, etc. So the result is great. You've got a really great result at the end. If you look at the before and after picture, it's a huge change in the person. We're not just trying to fix the teeth. We're also trying to improve the person's self-image and their general health. I mean, having gum disease in your mouth is bacteria, so it's not good for you. So once you remove all of that, your skin tone changes, and a lot of things happen within the body that are very it's very good. This case was done some years ago, and the reason I'm highlighting it is because I've seen this patient now just recently, and it looks exactly the same. We've taken an x-ray, the implants are completely stable, there's no bone loss, it looks great. And this is someone who had very aggressive gum disease. His own teeth were not going to last very long. They were going to be literally eaten to pieces, and they would have fallen out. But the thing is, once you removed all of those teeth, and the gum disease is then under much better control because there's no teeth to cause it. So in this instance, by removing everything, placing implants and making sure he's cleaning well, which he is, we're able to prolong the life of these implants, and also just in general keep his bone structure where it is. So it's been a really good result, but most importantly, it's lasting. So it's been, I think, 5 years now, and the bone levels are stable. They're exactly where they were for when we did the treatment. For probably 3 months after the treatment, the bone level stabilizes. So it's been nearly 5 years and they're stable. So it's a really good result. He's very happy. He's maintained his prosthesis really well. It still looks brand new, so we don't need to replace it. Sometimes people want to replace just the prosthesis every 10 years or so. And if we do so, we'll go with the ceramic one just because it will look a bit better. We specialize in ceramics, so we want to do ceramics for the top teeth at least, because we want everyone to have that wow smile. You can have the smile so that it really wows people, or you can have it where it just looks completely natural, like one of the other cases I've shown. So, but either way, we enjoy this part of the treatment because that's what makes people happy. One of the questions we get commonly asked is how long do implants last? Now it's a very subjective question, and the answer is also the same. So it really depends. Generally speaking, if the person is keeping it very clean and doing everything that they've asked of, which is essentially hygiene regularly every 3 months, we would recommend 3 to 6 months regular hygiene appointments, regular brushing, and they don't have any new medical conditions which could cause any issues with the implants, then they should last for many years, like 10, 15 plus years in these instances. The prostheses around 10 years, and then you may need to replace a part of it because wear and tear. The prosthesis will wear down naturally because we want it to. You want the prosthesis to wear because if it doesn't wear, it will be putting too much pressure on the implants, and then the implants will wear. So it's like a car tire, if you think of it. The car tire is there to support the suspension of the car. If you don't have if your car tires are completely bare, there's no rubber, your suspension is going to take all the load, and eventually what will happen is the suspension will collapse, which is basically in this case your implants. So you've got to see it like that, and every so often you have to replace the tires, replace the rubber, just to support the implants. So this is the way we see it. So the materials you want to use are not meant to be super hard. This is the other issue. In many ways, you don't want a zirconia tooth structure which is on zirconia, because it's too hard. It doesn't allow any give on the actual implants. So that's why when the ceramics that we do are softer ceramics, so they actually do wear. We want them to wear naturally because that's a normal part of the process. So implants can last many years depending on the conditions. Fingers crossed, we've not needed to replace any of these cases. You do sometimes get the odd issue with an implant, which you may need to deal with, but this is why when we do our cases, we're trying to place a few more implants. So if something happens to one of them, which can happen, then you've still got support of the other ones to hold it together. Now that is the biggest problem with an all-on-4 case. This is why we try and avoid an all-on-4 case where possible, because if one of those implants fails at the back, your case is collapsed. You can't have the prostheses sitting and functioning. So we always try to put 6 where possible on the top, because we don't want to take that risk. Because it doesn't matter how good you are at implants, sometimes they fail. And it's the main reason is nothing to do with the implant, it's patient factors. It just happens, The person may have something you're not aware of, or it just fails for no reason. And then you just have to deal with it. But if you've got another implant behind it, holding it together, then it's not such an issue. But if that's your last supporting implant, then it becomes a problem.